Good evening. I'm Eric Hackley, and this is Hackonomics. Tonight, we're going to talk about two different subjects. One, about the AIDS epidemic, to get some insights on that as to how to prevent it, how to better understand it, and how to help the people who have it. We're going to discuss that, and we're going to talk about the American Legion Post 148 as they more or less redefine themselves from being known as a party place to a community resource. And that's going to be a very interesting discussion because people go there on the weekends and have a good time, but American Legion Post 148 is much, much more than that. But on this first segment here, I'm joined by Patricia Veazy. Patricia, welcome back to the show here.
Thank you.
And you're an outreach prevention outreach coordinator?
That's my title. At the Positive Resource Center, we're formerly known as the AIDS Task Force. We're located at 525 Oxford.
Okay. As we get started here, what are your comments on Reverend Sadler? That was the lady who started the show off here, and she came down from Baltimore. She works with some type of a national NAACP AIDS program. Mm-hmm. And any comments about her, especially as she was talking about how it used to be AIDS was a white male disease, and it transferred over to blacks, I guess. Help me understand that.
Okay. First of all, she's very knowledgeable. I agree with a lot of things she said. As far as the transfer from gay white men to African American people, that was one of the misconceptions, and I think that's what lended to African American people coming in contact so readily, because they stayed focused on the fact that it was a gay white man's disease, thinking that that was someone else's issue, that was going on with someone else, and slowly it crept into the African American community.
So, where did all this stuff, where did it come from? Okay. Because as I've been preparing for the show here, I've always thought about that. Where did AIDS come from?
Okay.
Monkeys?
I'd really like to be able to tell you that this is exactly where it came from, but honestly, I'm not sure. What I focus on with my job is the fact that it's here and it's attacking our community in great numbers. Now, I can tell you some of the theories. There's the theory that it came from monkeys, because monkeys are genetically similar to human beings, and monkeys have something that's called SIV, semi-immunodeficiency virus. So what people think is maybe in the bushes of wherever people were hunting monkeys and eating monkey meat, and perhaps SIV became HIV. There's the theory that it's a man-made disease created to eliminate a certain race of people. I'm not sure if that's the truth, but if it is, it's failing miserably because it's getting rid of all race of people. What I want people to keep in mind is the H in HIV stands for human, and that's how it's transmitted from human to human. One of the things I face a lot, I work in the Fort Wayne communities. I go out to different sites. I talk about HIV, how it's transmitted. We also provide free, confidential, and anonymous HIV testing. Our HIV testing does not involve needles, no poking, no prodding. It's a mouth swab, and you get your results in 20 minutes. And one of the things that I've learned from the community, especially the African American community, there is such a deep-rooted sense of denial still in the African American community. So I think a collaboration of...
Denial, why?
Because still they're thinking it's a white man's disease, or not me, not my sexual partner. This could never happen to me. It's denial, where, a big component is we need to get educated about HIV. Find out how it's transmitted. Find out how we can protect ourselves from it so that we do not come in contact.
So now, as the outreach program coordinator, what do you do to do that?
Okay, I go out to different sites where they feel that people are most at risk. I work a lot in impoverished neighborhoods. I work in apartment complexes, and I go out and I provide maybe pizza and soda and get the people together and just give them this information. A big part of my job is meeting people where they are, because this is a very difficult subject. So getting them comfortable, getting them open, and sharing this information. We spread information in jails, drug and alcohol treatment centers and places like that. Basically anyone that would have us, just to make sure that we get that information out. And one of the big things that's important for me, Mr. Hackley, is breaking the stigma around HIV. I think that also lends to the numbers, because if someone, I've had situations where I test someone, they test positive, and because they don't want anyone else to know that they're positive, they disappear. Where in our agency, the Positive Resource Connection, we not only test people, but we have a second department, which is our care coordination department. So if I test someone and they test positive for HIV, immediately I can hook them into our care coordination department, and we help that person with whatever it is they may need. The big thing that we assist with is the cost of medications, because medications for someone with HIV can be anywhere from $2,600 a month and up. So we hook them up with programs that help them pay for their medication. We also have an in-house food pantry, because as you may know, nutrition is very important for someone who has HIV. So we make sure they have food. If they don't have housing, we help provide housing. We even help them with transportation to their doctor's appointments. And we'll have some clients say, you know what, I went to the doctor, they said all these big words, and I'm not sure what they're saying to me. We will even go with them to their doctor's appointments.
But now you just mentioned how expensive it is, the medication.
Yes.
So are you saying that if a person is not wealthy, it's still a death sentence?
It is not. HIV or AIDS is no longer the death sentence that it used to be. But the big key, the difference between life and death as it pertains to HIV, is knowing and not knowing. So that's why all of our services that we provide are free. The testing is free. The education is free. And if that person has HIV and they're unable to pay for their medication, we hook them up with programs that will assist them with that.
So when you look back at, let's say, Magic Johnson,
okay,
looking still strong and everything, is because he's looking so healthy, is that because he has unlimited money?
No, that's what most people think. I am a member of a program called I Support Magic, and probably about 7 years ago I got to meet him in person. Biggest dude I've ever seen in my life. But Magic has HIV, not AIDS, but it's not because he has money that he's looking healthy, because honestly, Magic takes some of the same medications our clients take. The only difference between Magic Johnson and us, the average Joe, it's not money, it's early detection. He found out early, he takes his medication, and he takes care of his body. And what I mean by take care of his body is, one of the big things that we're facing is a large percentage of our HIV positive clients also have drug and alcohol issues. So once we figured that out, we also added a program, our SPS program, where we have someone that works with people that have HIV and drug and alcohol issues. So it's not the money, it's early detection, taking the medication as prescribed. Once again, taking the medication as prescribed. Because we'll have people that'll take the medication, they'll start to feel better, and then they stop. And that's one of the worst things they can do. Because HIV is a smart son of a gun, and what it does, when it sees that small window of opportunity, it goes crazy. And the medications that person used to take to help them remain healthy may no longer work. Their doctor may have to find a whole new medicine regimen to get them to achieve that same level of healthiness, so to speak.
So when this first came out, that this disease was out here, how did the graph look? I mean, I know it was real high for a while. Then was there a dip because you had things under control?
There's not really. Now, there has been a dip as it pertains to gay white men, because as it was stated before, once they found out that it was in their community, they rallied around, they got educated, they went out and found funding to help, help them maintain. However, because it's a little latent in the African American community, we're in denial or whatever the case may be, or we're not advocating for our brother or our sister that has HIV. Instead, we're adding stigma sometimes, and the people become isolated.
Before I forget, this is a live call-in talk show, and I'm always guilty of this, of not mentioning that. I think the phone number might be on the screen, so if you have any questions for Ms. Veazy here, please call in, because I had a chance to see her in action, and man, she can answer questions all day long. She can answer questions as fast as you can ask questions.
Hopefully.
Well, tell me something. When you first took this job many, many years ago,
10 years ago to be exact.
did you have any false understandings when you came in?
Oh, definitely.
And how were you enlightened from on the job experience?
Definitely. I have to admit, I was guilty of the same thing. I thought that it was a gay white man's disease. But as I saw people coming into our doors and testing positive, I then learned that once again, it's a human disease. It's not about our race, our age. It's about being human and, for the most part, not be informed about how HIV can be transmitted.
Okay, now tell me about this National Week of Prayer for the Healing of AIDS.
Okay. It's the National Week of well, it used to be called the National Week of Black Church of Prayer. But basically, it's now, they've taken out the black. It's just the National Week of Prayer. March 5th through March 12th is what I think the date is. And basically, what I do is I go out to different churches, or I invite different churches to mention that in their sermon, explain to their congregation what it is. I've even been invited out to some churches, and I'll address the congregation about HIV and how it's affecting our community. It's basically just a time to come together and remember those that we have lost, and to understand how important it is to educate people about HIV.
As we continue with the conversation here, I want the staff to know that we're going to go a half hour here with this first segment. We're going to go a half hour. And so when I saw you the other day, it was a room full of clergy and other people. And I noticed that there's a major reliance on the black church.
Yes.
How is that working for you?
Slowly, it's starting to work. Honestly, initially, when I first started at the Positive Resource Connection 10 years ago, that was my thought, because my grandmother always told me, if you want something done, you go through the church. So that was my first stop.
That is a major misconception.
Yeah, well.
And we got to hate to address that.
Yes.
I mean, not knocking the reverence, but that is a major misconception that is destroying initiatives throughout this whole community. Because when they take it to the church, it dies.
Well,
that's another story.
Well, if we keep in mind that when we're going to the church, we're going to humans, and we're imperfect. So in the beginning, it was difficult. I basically had one pastor tell me that it was a moral issue. If people had different types of morals, they wouldn't come in contact. And I was steadfast, and I stayed with it, and I said, it is a health issue. Because I truly believe that's what it is. It's a health issue. And over my 10 years of doing this, I have seen some change. I have seen some churches open up and be willing to listen and even get involved. And I'm hoping that that's what we're going to continue to have happen. More churches opening up, getting involved, and trying to understand exactly what it is and being there for the community. That's what I'd like to see. Be there for the community. Because once someone has HIV, once again, it's not the death sentence that it used to be. They need a place to go where they feel safe. And that's what I like for the church to be.
What I noticed was you had a lot of support there.
I did.
And I'm looking forward I had a chance to speak with Reverend Paul Taylor.
Okay.
And Paul Taylor will bring it. He'll bring it home for you. And I didn't have a chance to get one of his clips ready to go here to be aired today. But he was talking about, if he was a young man, when he was a young man, and how kids are going to find things out on their own. And since, especially young men are so inquisitive, and they'll try things, especially if you say, don't do that.
Right.
How was your success? How has your success been in getting through to young men? Or the issue is a young woman issue?
It's a young person issue. And I know a lot of people aren't going to like to hear this, but I contribute that issue to the parents, the people that are supposed to be in charge, us. In most cases, we're dropping the ball. Because I have another program called Put It on the Table, where I allow teenagers to come, because we're pretty close to Southside. We're right across the street from Lures. We have to give them the information. We have to let them know what's out here and what could happen if they make certain decisions. Now, when I talk to most parents about that, what I mean by drop the ball, parents will tell me things like, well, I don't want to talk to my kid about sex, because if I talk to them about sex, they're going to want to have it. But I'm here to tell you, staying after and speaking with these teenagers, they're having sex and they're misinformed. They don't know what they're possibly exposing themselves to. So one of the things I also do is I work with parents to get them comfortable, either whether it's through a brochure or they bring their child to me, and I sit down and I give them the information. And I understand that's hard for some parents, but if we can assist, if I can assist, I will assist. As I was telling you earlier, I am the mother of two 14-year-olds. And oftentimes what people say to me is, how do you start that conversation? For me, now, that's a personal thing. That's between child and parent. But for me, in my household, I started a long time ago. When I was potty training my children, I didn't give them those little cutesy names for their body parts. I told them exactly what those body parts were called, in hopes that if I open up a line of communication later on when I want them to talk, they will. We really have to focus on educating our children, because unfortunately our youngest client came to us with HIV at 13 years old. But on the flip side of that, our oldest client came to us with HIV at 67 years old. So it's covering a wide span of people.
How is your experiment with putting condoms in barbershops working?
It's very positive, very positive. Not only do I put condoms in barbershops, there are condoms in beauty salons, nail salons, and liquor stores. Because I don't want someone to come to me, get tested, test positive, and I ask them the question, what do you think happened? And why didn't you use a protective barrier? And they say to me, I didn't use it because I couldn't find it or I couldn't afford it. We put them out there. If you don't come to my office to get them, which you can also go to your barbershop. You get your hair cut, you're looking handsome, grab a couple condoms on the way out the door. It's very successful.
Now, is it true that certain condoms don't protect you from certain diseases?
That I know of, there aren't any condoms on the market anymore that, you were probably talking about the lambskin, which is kind of porous and it had holes. All of the condoms that we have, if used effectively, they can reduce the risk for coming in contact. Keeping in mind, Mr. Hackley, there's no such thing as safe sex. The only safe sex is no sex. What a protective barrier is, it's safer sex.
All right, so now how does someone... So I guess you'll speak anywhere.
Yeah, within reason.
So what does a person do? I mean, how's it? What is that procedure to contact you?
Okay. Well, they can contact me at my office, and that number is 744-1144, and just kind of tell me basically what they want and what they're interested in, whether that's just education or whether that's one-on-one education, group education, or HIV testing. And I also would like to add, at our agency, not only are we only doing HIV testing, we're also doing STD testing and hepatitis testing as well.
Hepatitis?
Hepatitis C. It
comes from the exchange of needles?
Blood is one way that hepatitis is transmitted, yes.
All right, it was something I was going to ask you about. All right, now, as you're doing this, you had mentioned, okay, what group right now is the most at risk?
Okay. Well, of course, African American people are disproportionately coming in contact with HIV. And usually that's explained because of the number of African Americans. If you have a small number and a large number of that small number is infected, that's disproportionately. Right now, since I'm going to say probably 2014, the numbers for African American women in HIV are starting to decrease, and we're overjoyed about that. I'm hoping it's because I'm out there educating them, but it could also be the fact that they're getting tested, they're more aware. People are looking to their potential sex partners and asking questions. So I'm thinking those are some of the reasons that those numbers are declining. However, as happy as we are about those numbers declining, there is a group of people whose numbers are increasing, and that's African American, what we call MSM, men who have sex with men. Those numbers are on the rise. Between the ages of early 20s, so I'm going to say around 23, 24, until late 30s, those numbers are increasing for African American men.
Why?
I choose to believe it's because no one's educating them. You asked me earlier, how's it working, reaching out to people, reaching out to men? I'm going to have to say that has been a very difficult demographic for me to reach out to, African American men who have sex with men, because here in Fort Wayne, that's a very guarded community. We also do testing at some of the bars here in Fort Wayne, but that's not where African American gay men are, or should I say African American men who have sex with men. The reason why I make the difference is because every man that has sex with other men do not consider themselves gay or homosexual. And since a big part of my job is meeting people where they are, I address people as the way they want to be addressed. So it's hard to get to that demographic and say, hey, we're not going to judge you. Hey, we're not here to ridicule you. We just want to give you some information. Because that's a big deal in the African American community. To be a gay black man, it's a pretty big deal.
But it's being normalized through TV.
Somewhat, but you also have to keep in mind that we are in Fort Wayne, Indiana.
Okay. As we're winding down here, get my next clip ready to go here. Okay, I understand that there's one more event coming up to end this National Week of Healing. Mm-hmm. What's happening?
There is going to be a luncheon. The luncheon that you mentioned earlier was for pastors and clergies. This time we're going to include the first ladies of the churches and just kind of approach it from a different standpoint.
I mean, how is that different than the pastors? Do you feel that the women might be more receptive?
Well, you know what? Our pastors and our clergies, they're pretty busy. They're pretty busy with a lot of things. So we're hoping to be able to utilize the first ladies to give them the information, give them the tools, and then they could take it back.
Fantastic. Well, that's a whole lot to absorb here.
It is.
And I appreciate your coming out. And get this clip ready to go. And we want to thank Ms. Veazy for being here. And roll this next clip, please.